This patient is Mr. Neeraj Kumar. He's about 2 years old. He's from Patna district. He's got an intrinsic minus hand because of ulnar nerve paralysis following an injury. It's a classical intrinsic minus hand which is extension at the MP joint and flexion at the PIP and the DIP joint. The adductor pollicis is grossly vested, all the interossei are vested, and the lumbricals have gone. The supraclavicular block for regional anesthesia. We are doing an incision to retrieve the donor muscle for the reconstruction. Here we must keep in mind that the neurovascular bundles are on the volar side of the lateral border of the fingers. So the incisions must remain within the width of the profundus, because if we go further we are likely to injure the neurovascular bundle. Therefore, through a small incision we have retrieved the flexor carpi superficialis of the ring finger, and we have now separated the two slips which join together engulfing the profundus. We are incising the chiasma with which the two slips of the superficialis tendon are joined together. To retrieve it in the palm, we have to separate the chiasma before retrieving it in the mid palm. Incision in the mid palm. The landmarks are at the neck of the first metacarpal and 1.5 centimeter above the prominence of pisiform. That's the proximal point of the incision, and the distal incision is just below the proximal palmar crease. Here we have to keep in mind that the arterial palmar arches lie right there, the superficial and the deep palmar arch. Therefore, we have to take care that the incision remains below the palmar arches. Some part of palmar arch will be visible. We will try and protect those arches, and we will try to retrieve the flexor carpi superficialis of the ring finger. There are so many flexor tendons. Little bit of training, we are able to identify the flexor carpi superficialis, which lies in palm actually below the profundus. Here the superficialis lies below, and further distal it will become superficial. We have retrieved the tendon in the palm, and just proximal to the tendon we can see some anastomosis, which is the anastomosis of the superficial palmar arch. The two arterial arches have very large number of anastomosis there, so the dissection here has to be careful. Now we have retrieved the donor tendon in the palm. This is an incision through which we will dissect out the flexor pulleys. Here few points to be kept in mind is that the neurovascular bundles lie between the two metacarpals. So dissection, the deep dissection will be carried out only above the metacarpophalangeal joints and not between. We have reached to the A1 pulley of the flexor tendons of the ring finger. We have to carefully dissect the fibrous tissue around, because if the pulley is injured or pulley is cut, then we land in trouble, because then there is nothing else through which we can anchor the donor tendons. So we have now dissected out the pulley there.